that what COVID taught us is never to take anything for granted. More testing, yes, important. More diagnosis of COVID, but not to create the news and panic, but more to understand this new variant. Prevention of your own self from any infection has to become our own responsibility. So I'm going to answer your questions as not a microbiologist or a virologist or a physician, which I am, but also like a person who's actually been fighting the COVID war right from the front line as an administrator, and remember, as a cardiologist, because COVID was not just a lung disease. Equally, a large number of patients died from heart problems and subsequent complications, which were heart. So the cardiologist was equally involved in the fight of COVID as anybody else. And it was clearly a fight with everyone's mind and efforts and science into it. But I would warn you that this is not a situation of panic, firstly. We are going to see variants of COVID, and COVID has become endemic. COVID is just another flu virus. The only difference between the previous flus that we had been facing for years and years every winter, and for us, flu has been a usual thing, was that the COVID was a very vicious flu virus, which we had never expected or understood. And therefore, we're going to see variants of COVID as we see variants of flu every year. The importance of this is that what COVID taught us is never to take anything for granted, to be always aware and be ready and prepared and watchful for any variations of any viruses which come, which may actually be beyond our expectations. And I'm happy that all agencies, including the government, are watchful. Nobody is panicking about it. No one's thinking that tomorrow suddenly we're going to have the worst ever wave. No, that's not it. In fact, even for flu, as you know, which happens every year, we warn our heart patients, we warn our elderlies that flu is going to come. Protect yourself. Don't go out into the cold. Wear masks even for flu, which is, in your life, a routine happening where any relative can get a flu and you say, flu ho gaya, 2-3 din mein theek ho jayega. Well, that's what's likely to happen with any of the present variants of COVID, because these are endemic. It's normal for a virus to mutate. It's normal to have mild illnesses, flu-like illnesses, and it to disappear. Yes, genomic testing, watchful by authorities, and caution and care by elderlies and those who have low immune system is a natural phenomenon, should be followed, and should be not just followed for COVID, it should be followed even for the daily flus that become worse during winters. The virologists at the moment are clearly looking at it. The INSACOG is looking at it. It's too early to actually define how bad is it or how serious is it. And from what we hear, that it could be, because it's a variant of Omicron, it may not be as severe and may just be mild illnesses. But we must also remember that, yes, we have developed better immunity over this period of time. Practically whole of the country has either been affected by COVID not just once, but multiple times. And secondly, that enough vaccinations have been done around COVID. And an endemicity means that we are better protected by immune system. However, we must also be careful that even a flu in an elderly patient, in those with heart disease, in those who've got bad lungs, in those who've got immune system failures, even a common flu can be a serious illness and can take a life. So really, it's too early to comment on the virus, but what it is to emphasize the fact that the good habits at least must remain for the elderly, and we should continue to be cautious and watchful. And I'm glad that our health minister has been so proactive this time that he's actually held meetings with every state to say, watch out, look at it, don't panic, don't make your people panic, but at least remind everybody of those systems, which are good habits that we learned over the last 2-3 years, see what's happened is, and naturally so, you see, if you actually think of it, COVID only became lesser and lesser early this year. And if you look at yourself now, you've almost forgotten about it. In fact, now when you see somebody wear a mask, you say, I think he's being overcautious. Is he scared? Isn't that what we change? We want to forget that 3 years to say we are free and a happy bird. Yes, we are free, but let's be cautious, and let's be cautious for our elderlies. That I think is very important. Yeah, you're so right. At the moment, it's clearly a flu-like illness. It's not affecting the lungs to the same extent as we saw with Delta. You saw the lungs being less affected by Omicron than it was Delta. And of course, the first surge, which happened in 2020, was in a situation where we actually didn't even understand the virus at all, and we didn't understand what this was all happening. But clearly, it was not only a heart disease. COVID was also COVID was not just a lung disease or a heart disease. And as the virus has presently evolved, it seems that it's still a flu-like illness, which is, if you saw what happened during Omicron. And also the reason for some flu-like illnesses is, again, our immune systems, which have got better against this virus. Yes, variants can sometimes escape the immune system, but then vaccination and the fact that we've been affected by COVID, and most of us have been affected either clinically or subclinically, we know that we have enough immune systems, at least in the younger individuals, to fight that. The important thing is that variants can sometimes be vicious. And that is the reason why I think it is too early, just based on a few cases, to understand. Yes, it could be transferring very fast, like a flu-like illness, and that flu-like illness means runny nose, cough, upper respiratory infection, fever, loss of appetite. And some variants may affect one thing more than the other, like the Delta affected lungs more than anything else, but then some variants can cause more tiredness. Some variants can cause just a gastrointestinal diarrhea, vomiting, and nausea. More will tell us about this, but at the moment, any flu-like illness has to be tested. And the reason for testing is not just because we need to admit them into the hospital. Most of these can be handled at home and will pass off in 3 days. But if we don't test, then we don't understand the genomics. If we don't understand the genomics, we'll never see the viciousness of the variant. So the testing increase will pick up more of COVID, but that should not be the biggest news that we picked up more COVID. It's being done so that we can understand this variant much more than the previous variant. So it's not counting the numbers of COVID. It's as good as counting the numbers of flu, which is happening in this country. But it's more importantly, it is what sort of a variant is it? Can we understand this variant much before it actually overtakes us? You see, what did history teach us? It taught us that we were casual when Delta came in. Prior to that, we had actually felt after 2020 that we would not get affected. We have great immunity. The whole world is getting affected, but we are the ones who are safe. And therefore, we didn't watch out as carefully for Delta, but we watched out much better for Omicron when it came in. And I think that's what's happening at the moment. More testing, yes, important. More diagnosis of COVID, but not to create the news and panic, but more to understand this new variant. I think it is too early to do those. See, at the end of the day, prevention of your own self from any infection has to become our own responsibility. Yes, the government has taken the responsibility proactively. Our health minister has been amazing that he could call a meeting of all the states and actually say, look at your preparations for anything which may happen even 3 months later or 2 months, 6 months later, or may never happen. But even that remotest possibility it happens, look at it now. I think that's been a huge step, but that was not a step for panic. That was a step of preparedness. So actually, at the end of the day, I don't think that the government mandates your protection. It mandated vaccination, which was correct, but even that was not mandated. It had the preparedness for everybody to be offered vaccination. Now we're saying we know exactly how to prevent ourselves. We know that masking prevents us. remember a time that I used to be double masked, not even single mask, but double masked when treating patients. My father has been vaccinated at the age of 100 multiple times in the past. Even for this year, he's had his flu vaccine. At the end of the day, I'm not going to take my father in a congested surroundings in a hall anymore till the winter passes by. So at the end of the day, yes, we actually have to be careful, at least for our elderly, at least for our immunosuppressed, at least for those with heart disease, at least for those who are lung disease, those who have multiple disabilities, to be preventing and make sure, yes, that they don't go out into congested surroundings. They take care when they go outside with masks on. If they come to the hospital, yes, it's great to have masks. And I've seen a lot of our patients who are coming or waiting in the corridors having masks on. And I think that's a great one. We've got to continue our hand washing practices. And believe you me, every time I touch something, it's got ingrained into me that I look around for a sanitizer. I think those are extremely important. And in this cold weather with high pollution levels, again, purifiers and all those inside the homes will help all of us to tide over another variant, and in fact tide over even flu and other infections which happen so commonly during winters. So no mandates, but a self-realization that let's not forget our good practices, at least for the elderly population and the sicker population. Kids have always been more resistant to this, and of course, we know that flu also affects kids. You see, the whole question is not it affecting. I mean, you see how much flu is around you. Somebody other has got a runny nose or a cough and takes off a leaf saying, "Mere ko to flu ho gaya, 2 din baad aunga kaam pe." Correct? A good practice. We don't know whether that's a COVID variant. We don't know whether that's a flu, but a good practice that till it passes by. And Omicron was only a 5-day, process, not the 14-day and 18 days as we started off in the first waves and the second waves of Delta. It was only a 3-4 day at home and back to normal because it became non-infective after that. So I think what we're saying is that, yes, it could affect theoretically anyone, just like a flu does. Children are normally more resistant to these. Elderlies are more sensitive. But on the other hand, a flu is a flu. Take care. That's the point. Take care. Be at home. Try not to pass that flu on to others in every sensible manner for 2-3 days. And once you're afebrile and once the cough's gone, you're back to normality.
Stay with the Times of India for news breaks, analysis, interviews, and events. We bring you stories from your neighborhood and from across the globe as well. Subscribe to our YouTube channel. Hit the like button and press the bell icon so you don't miss any of our videos.